just so everyone can just, stay on track. And so there we go. So to kick it off, we're going to just start with just a basic anatomy and function and so on, anatomy and physiology of the digestive tract. It's important just to have that understanding, because digestion is not about the products that we take. There's so much more to it. So if we look at the digestive system and so on, it starts here with the mouth. Yeah, we use it to talk and we use it to make a noise and, for a number of other functions stuff. But that's where digestion, I'll go further into it. It actually, for me, digestion starts on the plate. But in our digestive tract, the mouth, we've got the salivary glands. They're actually situated right here. We produce saliva into the mouth. There's actually enzymes in that saliva. So it helps make what they call a bolus. So when we put the food in, we start chewing it, it's a bolus that it makes. The tongue plays a role in that, not just for taste and so on, but also it's a muscle. It moves the food around, creates that bolus. And then as we move down the pharynx, obviously, when we swallow, that's the top part of what we know as the throat, is the pharynx. The epiglottis, very important. That's that little valve that prevents us choking every time we swallow. It closes so that the food passes and doesn't go into our lungs. It opens then, so when we breathe, oxygen goes into the lungs. Okay, so it's a little valve that just between the trachea and the esophagus, it just closes that off. So the esophagus is that pipe. Now, what's interesting with the esophagus and the rest of the digestive system, it's if you feel the inside of your mouth, that is what the digestive system is. It's a mucous membrane and so on. But more than that, it's rings of muscles. Okay, it's important when we go into the function of the thing. It's a whole bunch of rings of muscles all the way down this tube. So it's a tube with these muscles. Now, those muscles are important for the movement of the food. As they constrict, obviously it pushes the food through. So it's that movement, kind of like, I guess you could say almost like a snake moving, same sort of concept. And it constricts all the way along. And as it constricts, it pushes the food along. So, okay, so down the esophagus into the stomach. Obviously, there's valves there that prevent. So there's a valve that closes off at the stomach to prevent the food from coming back up. Stomach, vitally important. Okay, the stomach produces enzymes, the hydrochloric acid in there. You need that pH. So a lot of people say, oh, but I'm too acidic. And then your stomach needs to be at around about a pH of just over 2.3. So it's extremely acidic. I mean, I think if you put a stainless steel spoon into that kind of pH acid, it would dissolve. So it's very, very acidic. And the reason for that is to activate these enzymes, all the digestive enzymes. If there's not enough acidity, even if that pH is at 3, those enzymes don't get activated, okay? It comes in when we go into some of the conditions why that's important. So the pH in the stomach needs to be. So what happens when we chew, busy eating, already our stomach is preparing. So that chewing of the food stimulates the stomach to release hydrochloric acid. It releases that to get the pH, because now it's preparing. It's saying, oh, food's coming. We need to drop that. Activate the enzymes, food gets there, digestion starts. Okay. The liver plays a very important role in digestion, especially the gallbladder. You'll see there the little green gallbladder. The gallbladder produces bile. Bile is an emulsifier. What that means is it breaks down fat. So if fat isn't broken down, it floats on water. Together with the bile, breaks it up so the body can then digest the fat. Okay. Pancreas, you can see it there, the little yellow thing under there, also produces most of the enzymes that are needed. Very important, produces the hormone insulin. Okay, we know that for blood sugar levels, but also most of the enzymes that we need for breaking down and digesting food come from the pancreas itself. So once the process in the stomach is finished and the food's properly digested, moves into the small intestine. That first C little shape there is called the duodenum. Then you move into the small intestines. There's 3 different sections, the jejunum and the ischium. And or the ileum, sorry, the ischium is, then that basically makes up about, it depends on people, but it's 3 to 5 meters. Okay, now put that in context, that's like a double-story house. You know, if you had to stand on the roof and drop your intestines off the top, they would hit the floor of a double-story house. So it's 3 meters. It's pretty high, you know, and that it's a lot of intestine. And the reason for that is it's the surface area. So again, why is digestion so important? Because it breaks down, and now all of those nutrients that are being broken down, absorption, and that all happens in the small intestine. So further digestion happens. Very important for moisture control in the intestines. Intestines also play a very important role in infection control. So the immune system and stuff. You must remember our mucous membrane from the mouth all the way is the closest contact our body has to the environment. Yes, we've got the skin, but the skin's quite a barrier. The rest is just this thin mucous membrane that's between us and our external environment. So it plays a very important role in protecting the body from any foreign threats. So it's immune function, it's absorption, and it's also water balance. And a lot of people don't realize that, but hydration and so on, small intestines, vitally important there. So food moves through there. Again, that peristalsis I spoke about, that contracting, and that moves the food through these 3 to 5 meters. Along the way, it gets broken down. Everything gets absorbed. You know, amino acids, because the proteins are broken down, the various sugars, the glucoses, the fructoses, whatever comes from the carbohydrates, all the essential fatty acids from our fats are absorbed. And then all the micronutrients, minerals, because of the water dissolve in the mineral absorption, vitamins, water-soluble vitamins dissolve in the water, absorbed. Fat-soluble vitamins dissolve in the fat and get absorbed in the small intestines. From there into the bloodstream, boom, and to our various parts of our body, brain, muscles, wherever it's needed, it gets carried over to. Okay, but the starting point is right there in the digestive tract. Once it's passed through, it passes into the large intestine, where further breakdown and digestion does occur. Probiotics are found in the large intestine, starts breaking down, fermenting anything that's left over, you know, breaking that further down, preparing it for excretion, you know. So all the way along the large intestine, you can see the appendix there, and then it goes all the way into the what's commonly known as the colon, is the large intestine, to the rectum and passed out through the anus. So that, in a nutshell, is the digestive tract. Okay. So digestion itself, we've pretty much gone through it. I said digestion starts on the plate. Okay. The reason I say that is it's very important to cut food into small bite-sized portions. And then once it's in the mouth, they estimate that you need to chew that what's in your mouth 32 times. And I can guarantee, I don't know, I might be wrong. I wouldn't put my house on it, but I don't think there's anyone on this call that chews their food 32 times. I know I don't. I used to years ago. I had a diagnostic machine that kept throwing this out, proper digester, and it was always chew your food. I started doing it, and it really makes a huge difference. You cannot believe the difference chewing your food has on the entire digestive process, with regards to function, regularity, and so on, bloatedness, everything, just from chewing the food roughly 32 times. So a meal obviously is going to take quite a while to eat. We're always in a rush. It's like, oh, we don't have time, got to gulp it down and all of that. And that's where digestive problems start. Okay, on the plate, too big, we're not chewing it enough, we're not creating that bolus, as it's called, preparing the food properly so that by the time it reaches the stomach, it can then just be broken down that much easier. Okay, so in the mouth, I mentioned earlier the saliva. Saliva contains salivary amylase that starts breaking down, especially carbohydrates. So all the carbohydrates and so on get broken down there. That chewing motion, as I said, releases and stimulates the release of hydrochloric acid, drops the pH to about 2.3. The enzymes then get released into the stomach, boom, activated, they're ready. Food gets there, starts breaking it down. Okay. The enzymes, generally your amylases, this is just general. They're more than this, and we'll go through it in the product. Amylases are generally for carbohydrate, proteases for protein, lipases for fat. Okay. Into the small intestine, that's where the assimilation and the absorption of all those nutrients starts happening. Large intestine with the probiotics, further digestion does occur, and then obviously excretion. So that's the digestive process from start to finish. Okay, so this is where it ties in nicely. If you've got that basic understanding, as I run through these things, you'll straight off the bat, you'll be able to see, oh, okay, now I understand. So indigestion, great word. It's indigestion. It says it there. Now you've got an understanding of digest. So why do we get indigestion? I have a bit of a problem with the word heartburn. I understand why it's heartburn, but because, it's reflux and burning and that, but it gets linked to acidity, and it's not always as a result of hyperacidity. Okay, and why I say that is, yes, it's acidity, but not enough acidity. So indigestion actually stems from not chewing the food properly, not preparing. So by the time the food gets to the stomach, the pH isn't right. So what happens in the stomach? It's like, nah, I don't want you here. You're not, boom, and it starts pushing back up. Now, even if that pH is at 3, it's going to burn, okay? But it's not acidic enough. So by taking an antacid, you're not really helping the situation. The way to curb and cure indigestion is obviously chew the food properly, spend time, slow down, smaller portions, chew, swallow, and you'll find that will go away immediately. And the same thing then will happen with the bloatedness, nausea, vomiting, those sort of symptoms that some people get, and so on. Just that basic starting point of cutting it smaller, chewing, swallowing, all of those symptoms start to disappear. Okay. Now, other things that we obviously see related are nervous type of things. And people are always like, oh, why? Sometimes you're like, oh, I get nervous, and it's like, oh, irritable. Or whenever there's anxiety, I have digestive upset, be it diarrhea or whatever, bit of nausea, some people vomit and that. And the link is the small intestine has so much blood supply and nerve supply. Okay, so there's this link with the brain. So if you're anxious and your nerves are on edge, those same nerves that are feeding the brain stuff are feeding the small intestines. And that then obviously irritates and stimulates, and you get this, let's call it upset digestion. So because everything is upset, and that's where upset stomach would then come, and related to anxiety, because it's that connection with the nerve supply. Obviously, we need it there in the blood supply. We must remember all those nutrients have to be absorbed. Everything's there. The other thing that's also important there with that nerve supply and stuff is the hormones that are produced by the small intestines. So there's this big thing around leptin. So we know leptin, but leptin is released, one of the hormones released by the small intestine. It's also released by fat cells, adipose tissue, but it's released by the small intestine to tell the body, I've had enough, I'm full, no more, switch off, sends a signal to the brain. Brain says, okay, stop eating, you're full. Okay, there's the opposite of that, and you'll see with the hormones, it's always that, is ghrelin. Ghrelin is the one that stimulates appetite. When your intestines are empty and you hear that, oh, I'm hungry, ghrelin gets released. That's the hormone. Boom, signals to the brain, oh, I'm hungry, feed me, eat, I need food. So it's all controlled there, and that link as well. So when we're nervous and we're under stress and so it does affect. So you get that reverse effect. That's why we get that impact during anxiety and so on. Okay. And that passes straight into the neck with gastric ulcers, hyperacidity. The stomach can, deal with it's made to work in an environment of 2.3, hyper acid and so on. But with stress, poor diet, we eat foods that are extremely acidic as well. That just, they contribute to this smoking, lifestyle habits, everything just contribute, and that just can't. So sometimes that pH, it can't cope, and then that acidity, various bacteria also get through and stuff, and then start creating a little, it starts with just a little nick, and then it just grows into an ulcer. The diarrhea, constipation can also be linked to the anxiety and that. And then diarrhea, constipation, those two go hand in hand with what we know as irritable bowel syndrome or spastic colon. So the simplest way of saying that is that link we said with the anxiety. Spastic colon, remember I spoke about the muscles that contract and so on? It's exactly that. So now those nerves supplying there's a problem. Now all of a sudden you either get a spasm where that muscle then in that specific area might be too contracted, causes constriction, and nothing can pass through, hence constipation, or it's the opposite, causes hyperrelaxation. So now all of a sudden everything just rushes through. There's no control on that, and hence the diarrhea. I mentioned earlier that the small intestines control water balance in the body. If there's a problem there, too much water loss, and that's where the diarrhea comes in. The opposite comes in, too much water taking, constipation. Okay, so there's a very important link with the small intestine there. And then some more serious condition, if we call it that, your ulcerative colitis or Crohn's disease. So the same way that you get a stomach ulcer, Crohn's disease and ulcerative colitis are ulcers in the small intestine. It becomes a really big problem, and it's obviously from progressive long-term use, poor diet, poor eating patterns, so on. There's a lot of damage that gets done. Remember I said it's like in your mouth, that mucous membrane. It can only, you think how soft it is, feel it with your tongue, stick your fingers in your mouth if they clean, and just feel it. That is all the way down. So something harsh going through there is going to cause damage. If you just get one little thing, it just spreads rapidly through there. So that's ulcerative and Crohn's disease you don't really want. Ultimately leads, flows into what we commonly now know as leaky gut syndrome, where stuff doesn't just get absorbed in the small intestine, but toxins and stuff seem to come back, and the toxins get absorbed that way, and then there's this wrong flow. So instead of nutrients going in, toxins and the byproducts are now getting absorbed because we don't have that barrier anymore. There's breaks in the intestinal lining. Okay. And then your gluten intolerance, also known as celiac disease, that's it's becoming quite common and so on. I like to, it's a bit like strange, but I kind of think that people that are gluten intolerant, that's the normal. And those of us that are tolerant to it have developed a tolerance to something that we shouldn't be eating anyway. Lactose, gluten, all of these things. These are things that over years, they're nice, they're lovely, but our bodies aren't conditioned to eat that. We can't break it down. We don't metabolize it. It's not in our makeup to do that. So, but over years, we've just become tolerant. So if you have an intolerance to it, it's actually your body saying, you shouldn't be eating this. So it's a good thing, and generally you'll find people that have to avoid that and that actually have really good diets and lifestyles and so on. It's hard because our modern diets are full of gluten or full of lactose and so on. So it is limiting for them, but indirectly, that's my personal opinion, it's a good thing. So it's the type of things that you're wanting to try and avoid and cut out of your diet, but it's now labeled as a disorder. So celiac disease or gluten intolerance is almost where the body is hypersensitive to the gluten. It's like an allergy. So the gluten comes in and it stimulates inflammation, and the symptoms are just bloatedness, diarrhea, proper digestive upset that happens with that, because it stimulates and it irritates that mucosal lining, and then you get all of those symptoms that come as a result of that. Okay, and all very similar to what you said: nausea, can even vomiting, diarrhea, constipation, all various upsets, indigestion, the bloatedness. So those are the basic symptoms and signs of some of these more serious underlying conditions. Okay, but again, having said all of that, These are all things that develop over time, okay? And as a result of poor digestive habits, poor eating habits, and so on. And it starts in our childhood. You know, we're all guilty of it. I'm guilty of it as well. You know, I don't show my children, you know, the right way to eat. I don't, you know, and that we don't do it. It's just our lifestyles don't allow it. We don't put in enough effort, but it's vitally important. Okay. So that's where supplementation can come in and help and just provide almost a support. And that's why it's a supplement. It supplements our lifestyles. So the Digest Assist pretty much put together, like we've spoken about, a combination of the digestive enzymes that we know in the stomach break down. There's also the enzymes in the intestines and so on that also help break down salivary amylase from the mouth, starting to break down. You can see it's a complete blend of various digestive enzymes. If you look through the things that break down plants, cellulase, you know, your maltases, amylases for the sugars, and then your proteins, proteases, papain, bromelain, okay, all of those are there, and then your lipase for your fats and that. So pretty much targeting all your macronutrients to help and assist with that breakdown. Remember, it's still important to chew that food properly. You still need to prepare the food, even if you're taking a supplement. That's still the most important thing. You know, try and advise people, eat slower, cut it down, make a concerted effort. They call it mindful eating, you know, and it's really important, you know, just to be a little bit more mindful when we're sitting and eating and so on. And just that alone will help. Okay. Then the probiotic blend, it's just the 4 probiotics, but the reason why is those 4 make up 80% of the probiotics. There are others, and a lot of the others might be more prevalent during childhood. Some are more important if you're on antibiotic treatment. Some are more important during elderly, you know, for elderly patients. But in general, the 4 that are here, the lactobacillus and the bifidobacterium, they form the basis of the most important probiotics. And a probiotic means it's a good bacteria. It's beneficial bacteria. It's bacteria that are normally found in our intestines. So it even goes as far as to say, and we label it as a disease and so on, but Candida, the yeast, is a probiotic. In fact, it's a bacteria, or it's an organ. It's not a bacteria. It's a yeast that should be there. It plays a role in digestion. But when there's an imbalance in our probiotics, in these beneficial organisms in our intestines, then it causes problems. So something like Candida will flourish when there's too much sugar, when there's that overgrowth. And then that flourishes, and all your other probiotics then come second, because now it's flourishing. So it's very important to create a balance. You can't have too much lactobacillus, for example, and then because your bifidobacterium, you need that balance. Okay, so they all play a role in that, but they need to be balanced, and it's important with that. And then dietary, you know, things like your natural yogurts, what do these things, kefir, you know, there's so many different things. What's that other one that I had the other day? The name's gone, but kombucha, you know, there's so many things that have these natural organisms that are nice to introduce into your diet, into smoothies and so on, that you can take. Strangely enough, the noni juice, also very effective with this when it comes to restoring balance and so on. I've had great results with people using that have digested, just drinking the noni and getting fantastic results. So it's not like it cleanses, or it's like a, what do you call it, like a laxative in that, but it does help, you know, keep people regular. So linked to your probiotics is prebiotics. And there was a question around that. It's like, what's a prebiotic? Prebiotic is the food for the probiotic. So they're living organisms, and for them to survive, they need prebiotics. And those are things like fructooligosaccharides, inulin, it's fibers, it's sugars, it's sugar molecule, and so on, substrates that these probiotics need to survive, okay, and to flourish and so on. So you need that to help restore the balance. You can't just take probiotics and there's nothing for them to survive and thrive on in the intestines. Okay. General dosage here. It's important to remember this is a digestive enzyme. It does have blood thinning properties. So people that are on blood thinning medication and so on should use it with caution. or under the supervision of their healthcare practitioner. Anyone with a planned surgical procedure should stop within about 2 weeks of taking it. It does thin, it's a good thing. It's not bad. Enzymes are also natural anti-inflammatories, so they help with inflammation. The reason why is because it's these improper or undigested material that gets absorbed. When it gets into the system, the body sees it as foreign. It's not a broken down molecule. It's now something else that's been absorbed. And the body sees that as foreign, and it stimulates inflammation in the body. It stimulates allergic reaction, asthmas, joint problems, all of these type of things. All can stem from improper digestion. So it's very important there. But the anti-inflammatory properties of enzymes comes from that. It's breaking down those molecules that are too big, that are causing problems in the system. Okay, so that's how an enzyme has an anti-inflammatory property. So the betaine HCl, that's there from a pH point of view to help to break down, get that pH in the stomach right. Okay, so it's an all-round product taken before meals. So generally I suggest maybe 30 minutes before a meal, can be before each meal, before your biggest meal, whatever, however. But in the beginning, depending on the state of that individual's digestion, probably before each meal during the day. Okay, but again, lifestyle, that chew the food, cut it small pieces, chew it 32 times. Can you imagine sitting there going 32 times? But we need to do it. It's important, and just from doing that, you'll see the difference on those. Okay, so that pretty much focuses all around digestive health, and then it pretty much, I just want to check here in the chats before we just, yeah. And so on. Yeah, diet, nutrition, everything like that. Yeah. So, yep, perfect. Then Mary asked that. But yes, like I've said, eating habits, what we eat, the types of food, very important for that. Ulcerative colitis, is it reversible? It is. It's a long process though, and it takes a lot of healing. So it takes a lot of focusing on, getting rid of like toxins, changing your lifestyle, introducing things that help, like your probiotics, amino acids, things like glutamine, things that just stimulate the healing process. You must remember, it's anything, wherever there's degeneration, that's a quick process. Repair, so if something's taken 10 years, and with ulcerative colitis and your Crohn's disease, that's not something that happened overnight. That's something that's happened over years. The same process that it took to break it down, you need that same process. You need that same patience to build it up again. If you look at a house, it's actually much easier to break a house down than it is to build it up, and the same in our body, so you just got to be patient. You got to make the right lifestyle changes. But yes, it can be reversed as long as you catch it early enough, and that, so that it doesn't progress too much. And David's got load shedding. We understand, David. And then what you'll see with the next, there was one around superfoods and so on, if they, assist and so on. It probably flows into the next. There we go, into the next one. So where a lot of your superfoods and so on actually have a lot of digestive benefits. You'll see, we'll go through it. I was actually surprised. So a lot of things I thought, I understand why you haven't done it, and then when I looked into it and that, I was like, wow, actually, and it's actually, yeah, it's really, a lot of these things are very good for detoxing. So in the PurifyMX, yes, it cleanses, removes toxins from the body, very powerful antioxidants. But as I was going through it, and it ties in very nicely, because a lot of these things are actually anti-inflammatory. They've got a lot of anti-inflammatory properties, and then it ties up with our digestion, with that poor digestion and these incomplete, broken down molecules going through, causing inflammation in the digestive tract. Why these actually are so effective, because reducing that impact that inflammation has on the intestines they can repair, they can recover, digestion can improve, and so on. So there's a lot more benefit to it than just being, oh, it's cleanse, and it does cleanse and detox, remove the toxins. So where does detox come from? Detoxification, taking toxins, removing them from the body. The liver plays a very important role in that, and that's where selenium, we'll go focus on that a little bit, but selenium helps with the production of an liver enzyme called superoxide dismutase, SOD, and that is a powerful liver enzyme that just, any free radical, anything, it binds to, scavenges that thing and passes it out, it breaks it down, can't cause damage in the body, and so on. So the liver that we said in the digestive, this is where its role comes into healthy digestion. So all the byproducts that are left in the system that might get into the bloodstream and stuff, the liver filters those out. Okay, we know with alcohol, so the alcohol we take gets absorbed, that's got to go somewhere. The liver takes it, neutralizes it reduces its impact, gets it out of the system, so it protects it from that point of view. I'm going on this side, but the liver's actually over here, everyone. So I'm like on the wrong side of my body. So it's on the right side, just under, and it's actually a really big organ. It's protected under the rib cage sometimes, and if you can feel it under there, then you might have a little problem. If it's a little tender and sensitive, it might be from last night's binge, but it's over here. You shouldn't really have any tenderness or that if you're feeling under your rib cage there. If you do, it's a sign of inflammation of the liver. It's just been put under a bit of stress, so that's where cleansing comes in, and cleaning out and so on. So if we go through these ingredients, and so I just want to start with the aloe ferox. It's a traditional South African or African, but really down here in the Cape, a lot of aloe ferox grows, known as aloe bitters. It contains a component called aloin. Aloin it stimulates, it irritates the intestines. So it comes in and it irritates, and it causes that peristalsis on a lazy bowel. It stimulates them, starts getting that constriction all the way through, and stimulates that process, and out goes and flushes out the system. And that's why it's really good for things like constipation. Now, because it's that irritant, it's also one of those things that you don't want to take on a long-term basis. That's where people call this laxative, almost like you get used to it. Your bowel gets lazy and stuff. You take a laxative, stimulate it, but then if you're not using it, then it's late in that. You don't want that, so you want to use it for a short period of time, 2 weeks, maybe 4 weeks, and then you stop for a period of another 2 months or so, and then you do it again. But it's not the kind of thing that you take all the time, your aloe ferox, purely because the body gets used to it. And it's like, I'll wait for him to take his aloe and then I'll work. It just becomes lazy. Okay. Then fennel, turmeric, and ginger, those three very important digestive aids. I was really surprised at the impact and the effect that they have on digestion. And, turmeric, they use it for chemotherapy-induced gastrointestinal symptoms. Okay, so that nausea, vomiting. So, you can almost see that picture. Someone that's gone through chemotherapy, what are they? It's that vomiting, the nausea, the diarrhea, everything that goes through there. Okay, ginger is commonly used for pregnant women. Now, what are those symptoms? It's very similar, the nausea, the vomiting, and so on. And ginger has that easing, calming effect on the digestive tract. And at the same time, relieving inflammation. Okay, so both turmeric and ginger are natural anti-inflammatory agents. So what's the last thing you take when you have an ulcer or anything like that? An anti-inflammatory. In this case, they help with that healing, okay? They're not going to aggravate that digestive thing. The other one that was very interesting for me was the cayenne. Cayenne, we know, is very good anti-inflammatory. They use it for headaches, anything, joint pain, and so on. But it also for the relief of dyspepsia, you say, well, wow, you know, like if I have chili, I get heartburn and so on, you know, but it's creating that acidity in the stomach so as that the digestion can occur. And then GERD is that gastroesophageal reflux disease, indigestion. You know, that's that funny name for it. So if you've ever heard of GERD, you know what that is. It's just heartburn or indigestion and so on. So, and again, all of these things, and a lot of them you'll see, I was finding help with, and it comes back to that question with the ulcerative colitis, is it reversible? These are products that have been used for relieving those sort of things, so those symptoms, helping with the healing, taking away that inflammation, helping the body recover and so on after that. You know, so I spoke about the selenium, but other things you can see all in there. Broccoli, it's a powerful antioxidant. Okay, it takes away, removes toxins from the system. Very good for gastrointestinal disorders and so on, but also from a detox point of view, very important to neutralize toxins. Chlorella, it's a superfood. So there was a question around superfood, and they're good because there's so many nutrients, and the nutrients in these superfoods are so bioavailable, which means the body can absorb them easily. It's not taxing on the digestive tract, you know, so it helps. So you're getting the nutrients, but at the same time, it's a source of fiber. The chlorophyll itself helps with healing. It helps with digestion and stimulates the whole process. Okay, so your general use here is just 2 capsules a day. Very important with this, though, is to drink up your water intake. Okay, a lot of these ingredients like fennel and so on are also diuretic, so you are going to lose water. There's a chance that you will have a bit of diarrhea when it stimulates, so you're going to lose more water. You need to be making sure you're drinking at least 2 to 3 liters of water a day. The water is also going to help flush all those extra toxins. The liver, we said, is going to be taking on this side. Sorry, the liver is going to be taking a little bit of a hammering there because you're cleaning it out, you're stimulating, it's working overtime now to get these. Drinking the water, helping the kidneys flush out all those toxins that have accumulated in the system. Okay, the type of thing I always recommend with the detox is at least twice a year. You can do it more. This is again my personal, twice a year. I normally suggest it's always at the change of season. So now, obviously March, we're going into winter. So after the summer, you know, we tended to eat. Now we're going into winter. Prepare the body. If we can clear the body of those toxins, we're stimulating the immune system. There's nothing fighting the immune system. So we're gearing our immune system up for what's coming in winter. You know, we're more susceptible to flus and so on and that. So there's more bugs hanging around and that. So it will help with that. And then coming out of winter again, so in August into the summer, exactly what it is, it's a spring clean. You know, you want to clean out the system again. Again, after winter, like hibernation mode, we haven't been eating right, we haven't been as active. We've also been sick. A lot more things accumulate in the system. You want to try and cleanse that out. So that for me are the 2 most important times to do it. But again, that's it. And it goes together with a good eating plan, you know, where you limit your intake of toxins. So you want a vegetable-based diet, you know, must be really, you know, fresh greens, fresh fruits, fresh vegetables, lots of water, juices, all of these type of things, a lot of greens, you know, we said there, chlorella, your broccolis, all of these things, parsley, all have these vitally important nutrients in them that help with the cleansing and stuff. And then obviously you could introduce then at that same time, from a nutritional point of view, the purely greens, you know, to go over with that at the same time. Who can't use this and where shouldn't you be, you know, which you've got to be careful with this because it's detox. People on chronic medication shouldn't use this and the chronic at the same time. So what I mean by that is don't take your 2 capsules of Purify with your chronic medication, with your water, and then spread it by at least, you know, if you're taking the one in the morning, maybe the Purify in the afternoon, or if you're taking your chronic meds in the afternoon, maybe the Purify in the morning, you know, so it depends, but spread it by at least 8 hours if possible, but, you know, you could probably get away with about 4 hours or so if you keep them apart. You don't want it, because it's got this detox and cleansing action. You don't want it to cleanse out the medication before it actually plays a role, and it's done its job in the system. So let the one work and then clear out the side effects, the byproducts and everything from that. Okay. And then, like I say, drinking lots of water, eating healthy, and so on. So I just want to check there. I think I'm pretty much done on that. Okay, well, then the basic difference, but I think it's pretty obvious now. So DigestAssist is for complete and efficient digestion. Okay. The PurifyMX is really good. It will help support digestion, but the DigestAssist to fix is to like the proper, I've got problem, don't introduce it, get your digestion right. The PurifyMX is there as almost that maintenance, the support, and then we know, like from a detox point of view, that fix it now, you got a bit of, you're feeling sluggish, whatever it is, use it at that, remove those harmful toxins from the system. It's all part, toxins will accumulate. It's normal. It's part of our healthy metabolism. Whenever something's broken down, it does produce a toxin, a free radical. But the liver, it's the side, the liver can cope with that, as long as we limit the intake. The problem comes in where the liver can't cope, where we overdo it. We take too much and the liver can't cope on a daily basis. And that's why it's important every now and then just to do a detox, a cleanse, and get that out the system. Okay, so that's pretty much it from me. I just want to check here if there's any. Yeah, okay. So a very important question, and it goes for any supplement, anyone on treatment for cancers. Should finish whatever course of treatment they're on. So if they're on a chemotherapy course, whatever it is, if it's 6 weeks, whatever, however long, finish that. After that treatment, yes, then you can start building that system up again, and supporting it with supplementation. But during the treatment, you don't want to interfere with anything. You just want to let that treatment do its thing, whatever it needs to do. And once the person has then gone through it, to support that recovery, obviously will come the right diet, lifestyle plans, and then the correct supplementation just to support that person through that recovery phase and building up again, because it's obviously very invasive treatment and they need whatever help they can get to build that up. So it's not just for these two products, it would go for any supplement, but definitely, yes, finish that off. And after a treatment like that, it might not, maybe you give it a couple of weeks, might not be a bad idea to then go on to almost like a 7-day detox kind of thing, to cleanse out and so on, and help the body, and then start the build up, before weight loss plans. Everyone just starts, I want to lose weight, and I go into a diet and stuff. I always recommend, wait, hang on, take a step back, detox first, clear the metabolic pathways. And then when you start on your weight loss plan, your results will be that much better. I mean, just think of it logically. If you just jump into weight loss, but there's a lot of garbage there, you're fighting a losing battle. You're producing more garbage. The metabolism isn't cleared or anything. So if someone wanted to start weight loss, what would you recommend? There we go. PurifyMX, do that, finish it, even if it's 4 weeks, finish the month. Eat relatively healthy, reduce your intake of toxins and so on. You can't for a month go on a detox diet, but for a week you could, and then you can just eat right. And then thereafter, when you start that weight loss program, your results will just be that much better. They'll be phenomenal because you've cleared out all the toxins. The metabolic pathways are now open, they're clear, receptors, everything's just waiting now. And then as soon as you start and you stimulate, the response, your body responds that much better to that weight loss process. Just want to see if there's any more questions. I just quickly want to just see, I try to build all of these in. Why is gut health? And okay, I think we've gone through that. Prebiotic, probiotic together. Why gut health causes anxiety. It's that link, okay, between that nervous system and our brain. There's that it feeds, the one feeds the other, and that Can gut health affect weight loss? Yes. You know, I didn't really focus on that. And also immune system, but everything. So gut health, and that's why it's becoming that, putting such a play on gut health at the moment, is because it almost supersedes everything. If you've got healthy digestion, immune system, because the immune function, is right there. We spoke about that. Weight loss, your metabolism, because you're breaking down, you're burning that stuff, your metabolic rate is now in overdrive. You just hyper metabolizing, breaking down nutrients, absorbing nutrients, stimulating the metabolism, and so on. So very important. Sorry, this thing keeps locking. Detox to cleanse and so on. Best way to cleanse your gut: water, fiber, the purify every now and then, but a lot of fresh fruits and vegetables. Okay, so it all comes down to fresh fruits, vegetables, fiber. Fiber works almost as a broom. It sweeps, it stimulates that peristalsis that I spoke about, the contraction. Fiber is very important, and make sure you get enough in fruits, veggies, other forms of fiber. Remember, though, when you increase your fiber intake, you've got to increase your water intake. Fiber absorbs water out. So it's like ProNutro. If you ever made a bowl of ProNutro, it's like you put milk, a liter of milk later, and you're like, okay, I can eat this now. Fiber does the same thing. It just absorbs. It just keeps absorbing that. So it's very important to keep drinking and keep yourself hydrated with fiber. Okay, can gut health keep inflammation under control? We spoke about that. Yes, it's very important. That's where inflammation actually stems from, is the gut. Incomplete digestion of foods. Okay, so you got to focus on that. You do that, and I guarantee you'll start seeing relief in joint, migraines, any kind of allergies. Big thing. Okay, some allergies are cat allergies and airborne and pollens and so on. But even that, the way the body responds to it will be different, because digestion is healthier, your digestive tract's healthier. How often? My personal point of view, twice a year, but it depends on individuals. I wouldn't say it's something that you do every month, but twice, 3 times a year. 3 times would be every 4 months. If you did it 4 times, that's every 3 months, probably, but that's, again, my personal thing. I don't think I'd push more than 4 times a year. Important to know. So I just, okay, these ones, why is it important to know the source of additional nutrition? Well, I think you just need to know, like what you taking in, obviously, from a digestive point of view. Like, you want to eat as healthy as possible. Preservatives, all these additives in food, they're not good. Like I said earlier, for me, like wheat and gluten and those sort of things, our digestive tract isn't geared for that. It stimulates inflammation, and that's not what we want. So try and keep it as natural as possible. It's difficult because in our times, there's insecticides on vegetables. There's everything gets treated, GMOs, all of these things. It's like, where do you draw the line? But as long as all around you're getting more fiber in and so on, you're trying to limit your preservative intake, any kind of food additives, processed foods, limiting those sort of things, and going more fresh, type of fruits and vegetables. And not to say that's all you eat, but just try and increase it a little, like maybe put an extra veg, or if you're going to have a pie, have a little serving of salad with it, and just try these little things. I'm not saying, hey, go change the world now, go vegan, go this or whatever. No, it's just mindful, just introduce little things. So nutrition is very important. Obviously, before digestion, what you're putting in there is important. And then how do you know it's 100% natural? I don't know that there's very many things that are 100% natural. It's become a marketing thing. Organic, organic is like, by definition, it must have carbon, nitrogen, or hydrogen in it, I think. So water, by definition, I don't think is organic, but it's natural, and it's good for you, water, but it's the way marketing has gone. So 100% natural is very difficult, you know, unless I don't even want to say, you know, the tomatoes you buy in a supermarket are 100% natural. I don't know, you know, it's becoming that because it's supply and demand. So yeah, it's a difficult thing. Maybe if you grew it yourself and you know you were in control of everything that goes in there, perfect, 100% natural, you know, because right from the way it's not packaged, so it's not in a container that's wrapped in plastic and so on, because that's not natural, you know, but the apples in there might be, you know, so that's a very difficult one. And I know with products and 100% natural and so on, it is difficult, you know, but what you can, a lot of the product and so on, the formulations, the ingredients, the herbals, the vitamins and so on, those are all natural, you know, the packaging that's in there, the excipients that are used are also the capsules or cellulose. So they are, I would say, predominantly natural. The word 100% is difficult for me. I always tell people try and stay away from 100%, but you can definitely say it's a natural product, you know, predominantly natural. So, but yeah, it's a difficult one, especially in today when it comes to mass production and getting things through. So I think I've run through most of those questions, incorporated what I could into the presentation. I don't know if there's anyone else, you know, there might be something that anyone, you know, wants to ask or stop share here.
There we go. Thank you so much, Dr. Trevor. Wow, it is so much information, and we would just love to be able to spend an entire week with you to get all the knowledge you've got around all the products we've got and why it is so important to look after a person's gut, especially, and to heal yourself from the inside out. So it was phenomenal to listen to you. An hour packed full of nutrition and value. So, Henri, I just want to say from my side, thank you so much, Dr. Trevor. We really appreciate your time, and we are super looking forward to the next training.
Yeah, thank you. And I am too. It's great. Yeah.
Yes,
so,
from my side,
if there's anything, any questions come up as people go along and so on, you're welcome to send them through. We will address them and stuff. If there's anything, you know, that anyone needs to know. And then for the ones going forward as well, as we do them, if you can send through your question, then I'll try and incorporate everything into the presentations and so on and try and get it as smooth as possible. But thank you everyone for your time. It was great. I enjoyed it.
Yes.
Thank you so much, Dr. Baillie. Sorry, yeah, I'm freezing on this side with my Wi-Fi, but thank you for your time. Thank you, everyone. Have a good evening, and we will be chatting soon. Thanks so much.
Much love.
Bye.
Enjoy your evening.
Thank you. Bye.
One.